Did you know that a common vitamin many people take every day can actually damage your kidneys? It sounds surprising, but that's exactly what happened to a 55-year-old woman. She took a vitamin supplement, believing it was safe and beneficial for her health, but instead, it caused severe kidney damage in just 1 month. What began as a daily routine to improve her health quickly turned into a medical emergency. So, what went wrong in this case? Don't worry. In today's video, we will explain everything, from the harmful effects of certain vitamins to how you can protect yourself from making the same mistake. So, keep watching. Firstly, let's start with a story that changed perceptions. This is the story of a 55-year-old woman who took her vitamins every day, like most of us do. She believed these supplements were essential for living a healthy life. However, things went terribly wrong in December 2012. She became seriously ill and had to be rushed to the hospital. Doctors were very concerned because she already had kidney disease, but this time, her condition was much worse. Her body temperature dropped to 93 degrees Fahrenheit, which is dangerously low, and she began to swell. Her heart rate also slowed down. The doctors initially thought her kidney disease had progressed, but the test results were shocking. Her kidneys had been functioning normally just 2 months earlier. Her creatinine levels have increased to 3,530 milligrams per liter, which is far too high to be safe. This clearly showed that her kidneys were not working properly. She was in a critical condition and urgently needed medical intervention as she could no longer produce urine. She was admitted to the intensive care unit and placed on dialysis. However, there was one thing the doctors could not understand. This was why her kidneys failed so rapidly. After conducting further tests, they discovered that a specific vitamin she had been taking daily was severely damaging her kidneys. And surprisingly, that vitamin was vitamin C, which was making her kidney disease much worse. Like vitamin C, an essential vitamin that many of us take to improve our immune system and prevent colds, this case highlights a critical point. It suggests that just because a vitamin is beneficial and easy to obtain does not mean it is safe. Moreover, many people believe that vitamins are harmless, but they can actually be dangerous, especially for those with pre-existing health conditions like kidney disease. It is also important to remember that no single vitamin is suitable for everyone. What works well for some people may not work for others. People with chronic illnesses, in particular, need to be extra cautious when taking vitamins. They should always consult their primary care doctor before starting any new supplements. Sadly, the story of the 55-year-old woman is not unique. More and more people are arriving at hospitals with vitamin-related health problems. One well-known case involves a young woman who frequently posted health videos on TikTok. She took large doses of vitamins to boost her immune system, but instead, she developed painful kidney stones and other health issues. Moreover, a 61-year-old man was admitted to the hospital, complaining of severe abdominal pain. At first, doctors suspected a problem with his pancreas. However, further tests revealed that his pain was caused by taking too many vitamin supplements. The kidneys play a crucial role in removing waste and excess substances from the body. If your kidneys are not functioning properly, they cannot eliminate extra vitamins, which can then build up and cause harm. This is why certain vitamins can be particularly dangerous for people who already have kidney disease. Now let's discuss some important vitamins that can be risky if taken in the wrong amounts. Number 1. Vitamin C. Vitamin C, or ascorbic acid, is an essential nutrient that helps with many vital functions in your body, such as absorbing iron from food, producing collagen, and protecting cells from damage due to its antioxidant properties. However, if you have kidney disease, you need to be careful with vitamin C. Vitamin C is water-soluble, so your body usually excretes excess amounts through urine. But if your kidneys are not functioning properly, they will not be able to remove the extra vitamin C effectively. This can cause problems, such as the formation of oxalate crystals in the kidneys. This is because the body breaks down vitamin C into oxalate, a compound that is usually filtered out by the kidneys. With compromised kidney function, excess oxalate is not properly excreted, which causes the formation of oxalate crystals. For instance, a 55-year-old woman who took high doses of vitamin C regularly developed severe kidney issues and required dialysis. Her condition worsened because the oxalate crystals blocked her urinary tract and harmed her kidneys. Moreover, for people with chronic kidney disease, too much vitamin C can be especially harmful. It can cause oxalate deposits not just in the kidneys, but also in bones and soft tissues, causing pain and further complications. Because of these risks, CKD patients are generally advised to limit their vitamin C intake. The general recommended dose of vitamin C for kidney patients is 60 to 100 milligrams per day, whether they are on dialysis or not. This amount is sufficient to meet your body's needs without the risk of oxalate buildup. Moreover, it is safer to get your vitamin C from natural food sources rather than high-dose supplements. Fruits like oranges, strawberries, and kiwi, as well as vegetables like bell peppers and broccoli, are good sources of vitamin C. Opt for these sources instead of supplements. Number 2. Vitamin D. Vitamin D is an essential vitamin. It increases the absorption of calcium from the gut and helps to maintain bone health, immune function, and muscle health. However, while adequate levels of vitamin D are important, excessive intake can be harmful and cause serious health problems, such as hypercalcemia and kidney damage. This is because it is fat-soluble and is stored in the body's fat tissue and liver, where it can accumulate over time and result in vitamin D toxicity. This condition is usually caused by taking high doses of vitamin D supplements over a long period and not from natural sources like sunlight or food. As mentioned earlier, when the levels of vitamin D in the body become too high, it increases calcium absorption from the gut, which causes increased calcium levels in the blood, a condition known as hypercalcemia. Hypercalcemia can cause symptoms including nausea, vomiting, frequent urination, excessive thirst, muscle weakness, confusion, and, in more severe cases, abnormal heart rhythms. Over time, high levels of calcium in the blood can damage organs, particularly the kidneys. The kidneys are responsible for filtering waste and excess substances from the blood, including calcium. When blood calcium levels become too high, the kidneys must work harder to excrete the excess. This increased workload can cause calcium deposits to form in the kidneys, which cause kidney stones and, eventually, kidney damage or even kidney failure. So, for your safety, it is crucial to follow the recommended guidelines for vitamin D intake, which is between 600 to 800 international units of vitamin D per day, depending on factors like age and overall health. Do not exceed 4,000 international units daily unless specifically advised by your healthcare provider. Additionally, take vitamin D with other essential nutrients, such as magnesium and vitamin K2. This is because magnesium is necessary for the activation of vitamin D, and it helps your body to use it effectively. On the other hand, vitamin K2 helps direct calcium to where it is needed, like in the bones, and away from areas where it could cause harm, such as the arteries and kidneys. This combination helps the body use calcium effectively. Number 3. Vitamin E. Vitamin E is an antioxidant that helps protect cells from damage throughout your body, including kidneys. However, while it offers some benefits, not all forms of vitamin E are safe, especially if you have kidney disease. The most common form found in supplements is alpha-tocopherol, a synthetic version that can cause serious health problems. Alpha-tocopherol is widely used, and you can find it in many vitamin pills, health drinks, and processed foods. However, this synthetic form has been linked to several health issues, including increased blood pressure, a higher risk of stroke, weakened bones, and elevated cholesterol levels. All of these problems can worsen kidney function over time, which makes it particularly dangerous for people with kidney disease. Moreover, if you have kidney disease, taking alpha-tocopherol can cause a buildup of harmful substances in your body. Since your kidneys are already compromised, they struggle to remove these substances, which puts additional stress on them. This can accelerate the progression of kidney damage and increase the risk of other complications. On the other hand, natural vitamin E, which is found in foods like sunflower seeds, is a safer option. Just 1 ounce of sunflower seeds provides about 66% of the daily recommended amount of vitamin E, without any of the risks associated with the synthetic form. Natural vitamin E helps protect your cells from oxidative damage, which is important for managing and treating kidney disease. For this reason, it's best to avoid synthetic vitamin E supplements unless advised by your doctor. Instead, focus on getting vitamin E from natural sources like nuts, seeds, and green leafy vegetables. And if you have kidney disease and you opt for vitamin E supplements, always check supplement labels and be cautious with products containing alpha-tocopherol. Also, consult your healthcare provider before taking any form of vitamin E. Number 4. Vitamin B12. Vitamin B12 is essential for producing DNA and keeping your brain cells healthy. However, not all forms of vitamin B12 are equally safe for everyone. The most common form found in supplements is cyanocobalamin, a synthetic version that is cheaper to produce. Cyanocobalamin contains small amounts of cyanide, a substance that can be harmful in large doses. For most healthy people, the tiny amount of cyanide in cyanocobalamin is not a concern, as your body can easily eliminate it. However, if you have chronic kidney disease, your kidneys cannot filter out toxins like cyanide, effectively causing its buildup in your body. This can worsen your kidney function over time and potentially cause other health problems. If you have kidney disease, it's safer to use methylcobalamin, the natural form of vitamin B12 that doesn't contain cyanide. For CKD patients, whether on dialysis or not, a daily supplement of 60 to 100 micrograms of methylcobalamin is generally recommended. This dosage is considered safer and helps you avoid the risks associated with cyanocobalamin. Additionally, some B12 supplements may contain other substances, like aluminum, which can build up in your body if you have kidney disease, further complicating your condition. In fact, research suggests that high doses of vitamin B supplements could accelerate kidney damage, especially if you have reduced kidney function due to diabetes. You may also be at a higher risk of vascular problems, like heart attacks or strokes. To avoid these risks, make sure to check the labels on your supplements and choose methylcobalamin over cyanocobalamin. If you have kidney issues, talk to your healthcare provider to ensure you're taking the safest form of vitamin B12 for your needs. This way, you can get the benefits of vitamin B12 without the risks associated with the synthetic form. Number 5. Vitamin A. Vitamin A supports your vision, skin health, and immune system. You can get it from foods like carrots, sweet potatoes, and liver, or as a supplement. While vitamin A is essential, too much can be harmful, especially if you have kidney disease. Vitamin A is fat-soluble, meaning it gets stored in your body's fat tissue. Unlike water-soluble vitamins, which are excreted in urine, excess vitamin A accumulates in your body. This can lead to toxicity if you consume too much. For people with kidney disease, the risk of toxicity is higher. Your kidneys normally help filter excess substances from your blood. When they are not functioning properly, they struggle to remove excess vitamin A, increasing the risk of harmful levels. The synthetic form of vitamin A, known as retinol palmitate, can be particularly dangerous. It's commonly found in supplements, but can cause serious health problems if taken in large amounts. Symptoms of excessive synthetic vitamin A include headaches, dizziness, nausea, liver damage, and bone pain. Even natural sources of vitamin A should be consumed carefully if you have kidney disease. Foods high in vitamin A, like fish liver, can also contribute to toxicity if eaten in excess. It's best to avoid vitamin A supplements unless your healthcare provider specifically advises them. If you need to supplement, keep it within the daily recommended intake of 700 to 900 micrograms per day. Getting vitamin A from foods like carrots and sweet potatoes is safer for most people. These foods contain beta-carotene, which your body converts into vitamin A as needed. This natural form of vitamin A is less likely to cause toxicity because your body controls the conversion process. So, if you have kidney disease, carefully manage your vitamin A intake. Always consult your healthcare provider before taking any supplements and aim to meet your nutritional needs through a balanced diet. And there you have it, a comprehensive look at how different vitamins can affect your health, especially if you have kidney disease. Remember, while vitamins are essential for maintaining overall health, it's crucial to choose the right forms and amounts to avoid potential complications. Thanks for watching. If you found this content helpful, please like our video and subscribe to our channel for more informative content.